You never want a serious crisis to go to waste. And what I mean by that, it's an opportunity to do things that you think you could not do before.
Good day, beautiful truth seekers. D-Train here. It is February 2021. Today I want to take you back in time just a little bit and show you that they told us they were going to pull this scam on us. They told us exactly how they're going to do it, and they told us what they were doing as they did it. Let's have a look back in 2017, when Fauci warned us this was coming.
I thought I would bring that perspective to the topic today, is the issue of pandemic preparedness. And if there's one message that I want to leave with you today, based on my experience, and you'll see that in a moment, is that there is no question that there will be a challenge to the coming administration in the arena of infectious diseases, both chronic infectious diseases in the sense of already ongoing disease, and we have certainly a large burden of that, but also there will be a surprise outbreak.
In October 2019, they told us how they were going to pull this off with Event 201.
Hello, everyone. I'm Anita Cicero, Deputy Director of the Johns Hopkins Center for Health Security, and today I will be your Master of Ceremonies for Event 201. On behalf of our center and our partners, the World Economic Forum and the Bill and Melinda Gates Foundation, I'd like to extend a very warm welcome to our audience here in New York, as well as our larger virtual audience participating online today. The goal of the Event 201 exercise is to illustrate the potential consequences of a pandemic and the kinds of societal and economic challenges it would pose.
As the COVID death numbers were mounting, they told us they were manipulating the numbers.
I think this question is probably for Minister Elliott, actually. I know you've taken questions before about how we include positive COVID-19 cases and deaths, but with regards to the one that we unfortunately just read about, the young girl, the word from Toronto Public Health is that she died of health complications unrelated to COVID-19, but did test positive. So I'm just curious if you want to reiterate why that is being categorized. If it's unrelated to the COVID-19 positive, why it's being listed anyway.
In some cases, I'm not saying specifically with respect to this case, but in some cases there are situations where there are other pre-existing conditions that may actually be the cause of the loss rather than COVID. COVID is there, but may not have been the cause of death.
Of the definition of people dying of COVID. So the case definition is very simplistic. It means at the time of death, it was a COVID positive diagnosis. So that means that if you were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that if technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death. I hope that's helpful.
There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
I want to reassure everyone that every single person who has COVID-19 listed anywhere on their death certificate is in fact counted. And even if it's not listed on their death certificate, anyone who has a COVID-19 positive test within a certain period of when they died is also counted as a COVID-19 positive death.
The Centers for Disease Control have updated their death counts for coronavirus and reveal yet again that COVID-19 is rarely the actual cause of death among coronavirus patients. According to the CDC themselves, of the 220,000 deaths attributed to the coronavirus, 87,000 of them died from pneumonia and influenza. Another 17,000 died from chronic respiratory diseases, and 26,000 died from respiratory distress syndrome. 44,000 patients died from hypertensive diseases, 23,000 died from heart disease, and a whopping 28,000 died from cardiac arrest and heart failure.
They even gave us their survival rates.
So if you look under 20, the survival rate, if you're infected with COVID-19, according to CDC, is 99.997%. If you're between 20 and 49, the survival rate is 99.98%. So under 50, that is less than seasonal influenza in terms of the severity. Now, when you get to 50 or 69, 99.5%, that's more severe than seasonal influenza. It's probably real severe, probably akin to a real severe flu. And then, of course, 70 plus, 94.6% survival rate. That is really, really significant. And that is where most of the hospitalizations and the mortality have come.
Since the start of the pandemic, close to 11,000 Canadians have died, and more than 10,500 of them were seniors and staff in long-term care, with most of the fatalities in Quebec and Ontario.
They told us that asymptomatic people don't spread viruses.
We've seen from our mass asymptomatic testing in Alberta is a very, very low positivity rate. So we're looking at around, when you look at thousands of tests that are done across Alberta every day, we're seeing on average only about 6 cases per 1,000 people tested, which indicates again that the risk of someone being actively infected when they have no symptoms and no exposure is very low.
We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare.
But the one thing historically people need to realize, that even if there is some asymptomatic transmission, in all the history of respiratory-borne viruses of any type, asymptomatic transmission has never been the driver of outbreaks. The driver of outbreaks is always a symptomatic person.
They told us healthy people don't need masks.
There is no specific evidence to suggest that the wearing of masks by the mass population has any particular benefit. In fact, there's some evidence to suggest the opposite in the misuse or wearing a mask properly, or fitting it properly, or taking it off, and all the other risks that are otherwise associated with that.
Masks that we recommend are for people who are at home and who are sick, and for those individuals who are caring for those people who are home that are sick.
One of the things they shouldn't be doing, the general public, is going out and buying masks. It actually does not help. It's not been proven to be effective in preventing spread of coronavirus amongst the general public.
If you do not have any respiratory symptoms such as fever, cough, or runny nose, you do not need to wear a medical mask like this one. Mask alone can give you a false feeling of protection and can even be a source of infection when not used correctly. Masks should only be used by healthcare workers, caretakers, or by people who are sick with symptoms of fever and cough.
Should you wear a mask if you're healthy?
No.
They told us PCR testing was unreliable.
If you're testing in a population that doesn't have very much COVID, you'll get false positives almost half the time. That is, the person actually doesn't have COVID, they have something else, they may have nothing.
If you get a cycle threshold of 35 or more, that the chances of it being replication competent are minuscule. So that if somebody, and we have patients, and it's very frustrating for the patients as well as for the physicians. Somebody comes in and they repeat their PCR and it's like 37 cycle threshold. But you almost never can culture virus from a 37 threshold cycle. So I think if somebody does come in with 37, 38, even 36, you got to say, it's just dead nucleotides, period.
How did they know they could pull this off?
Why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people.
Keep this in mind if you get your information from your TV.
I just say whatever they write down for me.
So why did so many people fall for this problem reaction solution scam?
We accept the reality of the world with which we're presented. It's as simple as that.
All right, folks, as usual, question everything. And God bless.